I know you're probably out there looking around for who do you want to see to help you take care of those sore knees or your spine or what it might be. You're probably hurting and you're looking for some different options other than what you've been doing. Stem cell therapy, it can get very confusing. If you've done any research, then you know that there are many different ways this is being done. You can use bone marrow-based cells, you can use fat-derived stem cells called adipose tissue, you can use placental solutions. A lot of doctors out there will pick one procedure that they do, that they've learned how to do, and then they will imply that that is the best procedure. So when you do come to our clinic, you get a different perspective because we do all of these different types of things. Dr. Holt will be able to tell you which is going to be the best type of procedure for your age, for your joint, for the level of joint degeneration, because certain things really are better in certain cases.
I'm a rheumatologist. I've been a rheumatologist since about 1979. Being a rheumatologist allows me, I've had to make judgments of how can I make somebody better the least toxic way and the best way. Okay, so they get good results, which are good results without side effects. You come to us because of my experience. The other thing you come to us for is because we have a combination of various factors, and they add a lot to how you do and how you respond.
So another thing to consider when you're shopping for a stem cell doctor, and one of the things that makes us unique, is the lab team. And this is important because laboratory processing is not all equal. Our team has the experience of opening up stem cell clinics around the world, some of the most advanced stem cell clinics in the world.
The lab manager has processed millions of stem cells on a daily basis. We use multiple sources of stem cells, meaning we use adipose tissue, we use bone marrow, we use platelet-rich plasma, we use platelet lysate, we use umbilical cord stem cells, we use placental amniotic solutions, or all of those or any combination of those. Multiple sources of stem cells really can have a synergistic effect so the patient gets the best outcome.
So PL sends out the signals very quickly, and you get benefit very quickly. Okay, and then PRP extends it. They're both basically the same thing, but it extends it over a much longer period of time.
And then we put that on a fiber matrix that gives them the cell's structure to bind to and grow on.
What the matrix does is it forms kind of a lattice work. A lattice work so that you can build tissues on it. Almost everybody that we see is somebody who has been to their family doc, their orthopedist, and the whole thing comes back to you need to have you need to have a joint replaced. But the problem is once you do a total joint, you don't have any other options. If it doesn't work or if it fails, then what you end up doing is you have to do it again. Now that I have stem cells, it's very effective. Compared to surgery, it's much less traumatic.
So we had a 70-something-year-old patient, and he loved to play tennis, and he couldn't.
Oh, that was it. I could not play with a pain level so high. Well, in speaking with my doctors, I had two choices, basically. Knee replacement or continued cortisone shots, which both were not attractive to me short and long term. I did my research. I got out there and started looking aggressively. I found Cendant.
He had both of his knees treated, and he's back to playing tennis, and he's 70 and he's beating 18-year-olds in tennis. It's
very easy overall. There's really no complications. You're in and out within 2 hours.
It's a great part of my job is knowing that you make people feel better every day.
What counts is they walk out of here feeling like you care about what's happening to them, and you care about what you can do to help them.
Call now for more information. 720-338-4491.